I'd like to welcome all of you to the fourth of 5 seminars in the theme research with people with mental health, ethical issues arising in research with people with mental health conditions. And as you all know, this seminar is on the ethics of neurodevelopmental disorders research. We have 3 presenters this afternoon who will share their work and engage us in the topic of ethical issues around neurodevelopmental research. And I'd like to introduce our first speaker, who is Ms. Zsófia Szlamka, who is a PhD candidate at King's College London. Zsófia's study focuses on understanding empowerment and barriers to accessing support service through parent-mediated interventions for caregivers of children with Autism Spectrum Disorder. Her main research interests include Autism Spectrum Disorder, understanding empowerment, and socioeconomic barriers to accessing support services. Zsófia, we ask you to share your presentation, which is entitled, Who Has the Right to Empower? The Case of Caregivers of Children with Neurodevelopmental Disorders. Thank you, Zsófia.
Thank you so much, Sharon, for the introduction, and welcome all. Thank you for joining this webinar today. I'm Zsófia Szlamka, and today I'll be speaking about who has the right to empower in relation to some studies that I've been doing as part of my PhD. So in my PhD in King's College London, this is my 3rd year. I'm writing up the studies that I've been conducting so far, and I've been looking at caregivers of children with neurodevelopmental disorders. In the initial stages of my PhD, my interests were really in how we can design caregiver interventions that would work across contexts, across cultures for families who have children with neurodevelopmental conditions. And in the beginning of this work, I realized as soon as I started doing some pilot work, some pilot studies, that some of these families, over and beyond supporting their children with neurodevelopmental conditions, have other needs, have other interests, and their experience of raising a child with special needs or with neurodevelopmental conditions go further and beyond those clinical needs that from a healthcare viewpoint we've been looking at. And so this is how I became interested in the concept of empowerment. On this slide, you can have a look at the structure of my PhD. In my first study, I was looking at the role of culture in service development and exploring the concept of empowerment. What does it mean to empower a family, a caregiver who has a child with a neurodevelopmental condition? And then later on in my 2nd and 3rd studies, I did case studies looking at the concept of empowerment in 2 contexts, in Ethiopia and then in Argentina. Today, I'll be focusing a bit more on this first study, exploring what empowerment means. It's a concept that in international development, in global health, we would come across fairly often, from high-level United Nations related documents to grassroots level NGOs trying to support these families. But what does it really mean to empower a family, empower a caregiver who has children with neurodevelopmental conditions? It was a qualitative work. We did focus group discussions and 25 individual interviews in a cross-cultural context, really looking at what empowerment means for different stakeholders supporting families with neurodevelopmental conditions. In the literature itself, what we see is that empowerment is often conceptualized in three different ways. The first one being psychological empowerment, really seeing empowerment as something about self-confidence, having skills, having individual characteristics that would lead to a feeling of empowerment. And secondly, it could also mean community empowerment, tools that would help a community, a group of people to feel empowered. And then the third approach would be economic empowerment, including microfinance skills, businesses, small businesses for a community to financially empower individuals. In our study, the key finding was that as we interviewed and as we did focus group discussions with different stakeholders supporting families with neurodevelopmental disorders, is that empowerment and how it's understood would be very different when we asked experts and when we asked caregivers. We spoke with different stakeholder groups, including clinicians, researchers, NGO representatives, social and healthcare representatives from country level organizations, as well as caregivers who have children with neurodevelopmental conditions. And what we found was that empowerment as a concept really does differ when we ask experts, professionals, and when we ask caregivers themselves. So the ethical issues that I identified while doing this work is that when we think about empowerment, such a core concept to global mental health development, supporting caregivers, supporting families, a core question is whose knowledge counts? Whose view is going to be taken into account when we decide as to how to empower, who has the right to empower, who can make the decision that here is a group that we take as a beneficiary, like caregivers who have children with neurodevelopmental conditions. And then we say, okay, now we are going to intervene, and now we are going to implement something to support them, to empower them. And then myself being the researcher in this position, it raised the question as to who is interpreting knowledge, who is interpreting that process of empowerment, looking at who the beneficiaries, what the outcomes are, and how to achieve those outcomes. And so here I just wanted to make that point on positionality. Later on in my PhD, I went to different countries. I went to Ethiopia, I went to Argentina. In Ethiopia, I did not speak the local language. In Argentina, I did speak the language enough to be able to do interviews by myself. Positionality, myself as a PhD researcher coming from a psychologist background, really does seem to play a key role in answering these questions. Whose knowledge counts? Who has the power to empower? Who is interpreting knowledge? And interestingly enough, from a psychologist perspective, being a PhD student, it was a concept that we did not learn much about. So it was something that I had to somehow self-teach or learn by myself. So a couple of lessons learned in this work. First and foremost, culturally sensitive definition does count in empowerment. We have to be able to define empowerment according to where we go and who we speak to. Culture does play a role in what empowerment outcomes might mean. And then secondly, how can we implement a caregiver-centered empowerment framework? And here I wanted to illustrate it with an example. When we spoke to professional participants who support families with neurodevelopmental conditions, many times they would mention things like, these families, these parents have to be taught about how to take care of a child with a condition. These parents have to learn new attitudes. They have to transform their attitudes. So some of them really took that viewpoint that coming from a professional perspective, we have to give skills that these parents might be lacking. Whereas when we spoke to caregivers themselves, they would say, well, in fact, we do have that intuitive knowledge. We do have that experience raising a child with a neurodevelopmental condition. What if that knowledge becomes the core of any empowerment concept, any framework that is trying to intervene or support a family who has a child with a neurodevelopmental condition, especially in lower resource settings? And then thirdly, a lesson learned reflecting on my role as a researcher in this work is how can we make sure that consent forms when we recruit participants are more power balanced. When going to families, when recruiting professional participants from NGOs, for example, many times they do find themselves in a position where consenting, when reading those consent forms and participant information sheets is really quite challenging and time consuming. How can we make sure that these consent forms to participate in research become more power balanced? I have some key references for you, and I just wanted to once more highlight that the lessons learned here are being culturally sensitive when it comes to defining empowerment and designing caregiver-centered empowerment frameworks. And with that, thank you so much for your attention.
Thank you so much, Zsófia, for introducing our topic on ethics. And I think no better way to introduce the seminar where we are looking through your research at the various lenses that can be applied to ethical research, that of the researcher, the participant's community, and various stakeholders' perspectives, to bring all of that into our consideration of ethical conduct of neurodevelopmental research, particularly given the vulnerability around communication capabilities of people with neurodevelopmental disorders. So thank you so much for that. I encourage participants to think about that presentation. And if you have any questions, comments, or suggestions, or information you want to share, share that in the Q&A. And we will take each presentation after each other, and then as a group engage in discussion thereafter. So to go to our next presentation. The next presentation is by Dr. Ruth Tsigebrhan, who is a psychiatrist and a PhD fellow at Addis Ababa University College of Health Science, Department of Psychiatry. She has a master's degree in mental health service and population research, and her PhD project focuses on comorbidity of mental disorders in people with epilepsy and the impact in rural parts of Ethiopia. And Ruth, we invite you to share your presentation with us, and entitled Exclusion Criteria versus Ethical Principle of Justice in Conducting Research in a Low-Income Setting. Thank you, Ruth.
Thank you, Sharon. I am Ruth, and I'm from Ethiopia. And I'm a clinician and also a PhD student. And I will be talking about the implications of upholding the ethical principles of justice in conducting research in low-income setting. So my research project involves the detection and the prevalence of comorbid mental disorders in people with epilepsy and the impacts of these comorbid mental disorders on quality of life, seizure control, and functional disability in the rural parts of Ethiopia, which is the southern parts of Ethiopia. And we did a prospective cohort study with 6 months of follow-up. And also we did also a qualitative study to investigate the perspective of these individuals in assessment of quality of life and in the context of epilepsy. So some of the results have been published, and I'm still working on my PhD, final parts of my PhD. So while doing this research project, we tried to do, we sought informed consent and witnessed verbal consent for illiterate participants after adequate amount of information was given to the participants. But we had an exclusion criteria. So patients or participants who have substantial cognitive deficits and who are not able to communicate, and those individuals who are having, who lacks the capacity to consent were excluded. But while the ethical challenge that I have faced while doing this PhD was that I have faced with a number of adults who have developmental disorders and epilepsy. So our research question was very much applicable to those individuals, but even much more applicable to these individuals. But we were not able to assess these questions because of the questionnaires and the information sheet that we have was in line with those individuals who have typically developed intellectual capacities. And our research team didn't have the appropriate training and competency to support the inclusion of neurodevelopmental disorders. So despite the fact that it's important to protect these individuals from coercion and abuse, but exclusion of people who have neurodevelopmental disorders and epilepsy have a lot of impact. It doesn't give us a complete picture of what's happening in the reality, especially in the African setup and in Ethiopian setup. If we don't have evidence to identify their specific needs and also to evaluate the impacts of having this illness on their life, it's not a complete picture. And also we need to understand these individuals in the context of their family care, especially in African setup. So having this research evidence has a lot of implication for packages of care and also for service delivery, especially for policymakers. And also it has an implication on improvement of training package and improvement of curriculums and training packages for mental health professionals. So the ethical principles of justice say that there is equal distribution of the benefits, the cost, and the risk of research, and also the cost of the allocation of resources. But if we don't have equal balanced way of gathering information, so how can we say that how can we have an equitable distribution of resources? So in conclusion, involvement of people with the neurodevelopmental disorders in healthcare research has a lot of advantages and tackling social and economic disparities, but it has been challenging, especially in low-income settings. So what can be done to promote the participations of adult people who have neurodevelopmental disorders in research? So there are a number of strategies that has been suggested by scholars. So as a researcher, we need to form a collaborative relationship between the researchers and the participants, so that to show our compassionate and respectful way to promote their ability to consent. And also we should be able to recognize and support the different levels of support needed by these individuals, and also assist them in making decisions by providing understanding that these individuals might experience the power imbalance between the researcher and the participant, and forming a clear relationship between the researcher and the participant is also very much important. And also we should promote understanding of the research objectives and also the information sheet by giving them a simple jargon-free language and symbols, visual aids, and also presenting the information in a repetitive way and also in a familiar situations is very much important as a researcher to promote the participations of adult people who have neurodevelopmental disorders. And also we need to adapt these techniques to our setup and test it, which one is working and which one is not working. And also primary caregivers, which are the trusted supporters of these individuals, can be also included to facilitate their understanding of the research objects, also the information sheets. So as an ethical committee, also one of the reasons for exclusion of people from the research is the lengthy process of getting approval from the ethical committee. So having a presence of strong and independent and knowledgeable ethical committee has a role in promoting the inclusion of these people, and also avoidance of unnecessary abuse and coercion. And researchers also should work in collaboration with the ethical committee. Inclusion of people who are actively working with these people, and also even involvement of people who have neurodevelopmental disorders in the ethical committee might also help in shaping the understanding and also for effective practice. And it's the ethical practice is a shared commitment, and it should be independent of funders. So that's all I have for today. Thank you for listening. That's all. And this is my references. Sorry.
Ruth, thank you so much for a challenging presentation to us, asking us to shift out of our known boundaries of what ethical research pertains to, and to think out of the box using experience such as yours, and also challenging us to publish and to present the work we are doing and the challenges we have to conduct ethical research with people with neurodevelopmental disorders, and how to, stretch our capacities to meet that challenge. So thank you so much, Ruth, for your presentation.
Thank you. Thank you.
We will then go on to our third presentation, and this presentation is by our colleague, Dr. Ashok, who is a professor of psychiatry in the Department of Psychiatry at St. John's Medical College and Hospital. And he heads the Center for Advanced Research and Excellence in Autism and Developmental Disorders within St. John's National Academy of Health Sciences in Bangalore. His work includes developing processes for early identification of autism and evolving feasible models of care. And his presentation will be sharing some of the insights he's gained in terms of ethical practice from some of his recent research in that area. So Ashok, we welcome you and ask you to share your presentation.
Thank you, Sharon. Thank you for the introduction. I'm a psychiatrist. I work at the St. John's National Academy of Health Sciences in Bangalore, in the southern part of India. And this is some members of my team. The CARE-AD, the Center for Advanced Research and Excellence in Autism and Developmental Disorder, is housed within the building called the Unit of Hope, which is the St. John's Center for Children with Special Needs. Coming to the background, the good news is there's been an increasing appreciation of needs of children with autism in India, in urban areas of country in the last 10-15 years. In fact, a national program for setting up district early intervention centers for childhood disabilities under the Rashtriya Bala Swasthya कार्यक्रम, which basically meets the National Child Health Program, has been actually put in place. It covers a variety of childhood conditions, and it includes disabilities that also autism actually comes under this as well. One of the lacunae is there is lack of suitable autism screening tools for children below 18 months in India, and that's what's led to our current study. In this study, I mean, it's a two-phase study. In the first phase, we used a mixed method design to develop a questionnaire of 24 items. After the qualitative phase, we had the discriminant validation phase, and this was presented last year at the Autism International Society meeting last August in a virtual mode. And the phase 2, which is actually central to the presentation today, is where we went for the predictive validity of our screening tool. And during this particular study is entirely supported by the Indian Council for Medical Research from New Delhi, and it's approved by the Institute Ethics Committee of St. John's National Academy of Health Sciences. The main part of the predictive validation study, I mean, it involved advertisements in the waiting rooms of 12 community health centers and hospitals. The forms were kept there for parents' attention, and these forms included the subject information sheet, the informed consent forms, and the screening tool with which the receptionist was the actual custodian of these tools. The advertisement pointed in the direction, and these forms are available in English and 4 of the South Indian languages. The sheet did mention that there would be assessments for some of the persons based on the way they have endorsed various items in the questionnaire, and some of them it would probably also happen 6 months later, and some of them it would happen at both time points. This was mentioned in the forms. This is something very important for the case study that I'll be presenting now. And periodically, the research assistants would go across and complete these forms from these centers. The index case, this is of a parent of a screen positive child not willing to participate further. Now, we did try and reach out to the parent. At first cut, she was not keen on coming. She was also very upset that she was being called for an assessment which she did not think she needed at all, or her child needed at all. The research team persisted. While I'll be discussing the issues later, it's debatable. The subject information sheet would have said that you're free to not participate in the study. The research team persisted, and that's what brings up the issue for today's presentation. And They also, along the way, as part of the discussion, they said that she had actually agreed when she signed the informed consent form that she would be happy to come for an assessment subsequently. Eventually, and we also got in touch with the pediatrician who was actually supporting this research in his center. Eventually, the parent came to our center. She came just to say that I came here because you said I've actually signed up to participate in this study. I come to tell you that I have no reason to, I don't think there's any reason for me to participate any further in the assessment. And she also mentioned that she had no knowledge of further assessments while she was actually filling up these forms. We actually did speak to her at some length. We apologize for any inconvenience that had caused, and she, however, refused to have anything more to do with us. We informed of our concerns to the pediatrician, and we do not have any follow-up on this matter subsequently. The issues here, one of the clinic, there are three different issues that we actually teased out of this. There is the clinician researcher's dilemma. I mean, the entire purpose of this study was to make sure that we are able to identify more children very young in the Indian context who can actually be then brought into early intervention programs. And here was a possibility. In fact, this particular child, the mother had endorsed a lot of the items on that scale. So we really felt that this could probably eventually prove to be, when we follow up 6 months later, to actually have a diagnosis of autism. So we were really very keen that we actually assess the child in detail and see if the child needed help straight away. So now, this was the dilemma that actually overcame the researcher's idea that he should not be actually persisting if the family is unwilling to actually take part in the study anymore. Beyond this, the other ethics issues were in the actual process of ethics. Was there clarity within the informed consent process? We have actually thought about this at some length. We felt we had actually put down what were the steps that's going to be followed once we collect the forms from there. But again, these are something to be thought about. Of course, in all these kind of research, there's the issue of false screen positives and parents not being adequately prepared for it. I mean, that's something we had actually factored into it, and we knew that this issue might come up, but as we'll come back to later about how we actually thought of dealing with these issues. Then, of course, since this presentation is brought in about neurodevelopmental disorders in low-income countries, I thought of including the issue of thalamic issues also. Now, it's possible that many families who do participate in research in our context may not be fully aware of what the research engagement entails. In addition to that, there are issues of inadequate funds to have a research assistant at each site so that they can actually support the families when they are filling up these screening forms. I've just marked some of these as potential solutions. Definitely, it stands to reason that we must make the participant information sheet and the informed consent forms user-friendly. I mean, we could probably have much more elaborate write-ups. We could probably have audiovisual. Mostly it would be wonderful if we had enough money to have a research assistant stand there and actually support the families when they're doing it. Pilot studies to specifically understand and improve research engagement of families. This is a point that came up when we, as all the panelists, had a discussion prior to this presentation today, and I really thank Professor Sharon for this. Now, we did our pilot study to find out how many children were coming to the center. Has the doctor taken part in research of this nature in the past, and so on. We didn't really go through the pilot. With the pilot study, didn't really go through about the actual steps that would actually happen when the families start using these forms. Then training of local staff in each center. This definitely couples both the idea of building awareness and also optimizing support for research participants. So if you did not have enough money to actually have research assistants in each of the centers, maybe the receptionist there can get trained. I would think that in our kind of context, the receptionist would probably feel very much empowered by this whole process, and would probably even pro bono, they would be quite happy to do this. This is a step that they did not think through earlier, but this incident has made us think about these kind of solutions. Subsequently, since our center actually intends to do a lot of longitudinal studies, there may be multiple time point assessments, there could be biological assessments. This particular incident made us feel that we need to really understand the perspectives of the family before we actually put the research steps on the ground in place. And we are now chosen to actually develop a body of parents, fairly informed parents who are actually parents of children with autism, who have gone through the difficulties of the children in dealing with their children, in managing their children, in helping their children. we have actually formed this body of 8 parents to oversee research in our setting. And it took some convincing for parents to actually take this up. And as I heard Zsófia's presentation, I did feel that she would probably want to know about how they're going to be empowered. This is something that occurred to us. They had their first meeting yesterday, and we were just observers in the meeting, and whatever forms and details about our research they wanted, we were willing to supply it to them in that meeting. We feel that even such a group probably needs, they probably need some amount of maturation to develop adequate sense of empowerment, that they can actually question about how these steps, how the research steps are being implemented on the ground. These are some of the thoughts that have come to us from this unfortunate episode that happened as part of our research finding. Before I finish, these are some of the references that I've highlighted in the slides. Special acknowledgement of support for this presentation to Dr. Sharon. She really helped us, went through this and gave some valuable suggestions, the whole GFBR team. And a special thanks to Dr. Manjulika Vas, the head of Humanities Division at St. John's Research Institute, who actually got me involved in this program. Thank you.
Thank you so much, Ashok, for that presentation. And what a joy to go from Zsófia's presentation on empowerment to your presentation, which ended on the note of empowerment, again, showing how important this kind of meeting is, where we share knowledge and learn from each other. I also want to thank you so much, Ashok, for your frank presentation, showing some of the difficulties that you experienced. And I think that's also another thing we need to be prepared to do with each other and colleagues, is to show some of the difficulties we've had so that we can learn from each other and do better by our clients and by our research participants. So on that note then, I'd like to open up the discussion for questions. In the Q&A, there's a comment from Talisa Fanta, thanking you, Ruth, for raising an important issue. And furthermore, no questions in the Q&A, but certainly more than enough time for us to take some lively discussion. And yeah, either post your questions in the Q&A or, Adam, I'm not sure if you can notice raised hands, but yes, please feel free to raise your questions. And I'd like to ask the panelists just to put on their cameras so that you can engage with the audience. I'm asking not only for questions, but also for lessons you might have learned from your own research, which you'd like to share with this group, which pertain to the issues that were raised by Zsófia, Ruth, and Ashok in their presentations. Thank you, Catherine. She says that my sound keeps cutting in and out. I'll try to speak slower, and I hope that this is better. Unfortunately, I'm calling from South Africa, and we have load shedding over here. So I'm on a mobile lifeline to this conference. My apologies for my poor sound quality. Thank you. I'll speak slower. Thank you, Catherine, for the feedback. So while we're waiting for questions from the floor, I think maybe I have a few questions to ask of you, of the panel. The one thing I noticed that was common to all of your presentations was the issue of communication and how one needs to communicate with, I think we're all agreeing that it would be good to improve the participation of people with neurodevelopmental disorders in research, either as research participants or, as Ashok intimated, as people that could inform our research going forward. But the issue of how to accommodate and provide information and participation in research in a way that is accessible to people with neurodevelopmental disorders. And maybe if I can ask that of the panel, some of your thoughts from your research experience on how you think we might improve the communication with participants, Ruth and Ashok, you both mentioned that as research participants, we might be looking at revising consent forms, simplifying information, using visual ways of sharing information about research. But I'm wondering, beyond the research participant issue of consent, whether you have any other thoughts around bringing, tailoring communication to people with neurodevelopmental disorders, not only as research participants, but also as potential collaborators in research. Your thoughts on that question?
Shall I start?
Thank you, Ruth.
Okay, thank you. In addition to the things that I have mentioned on the presentation, in my view and also in my experience, the primary caregivers of individuals who have neurodevelopmental disorders and these people, this vulnerable group of people, you cannot separate them, especially in our setup. So they are a good source of information and also a good supporters to promote the participations of adult people with neurodevelopmental disorders. So not only just giving us information, but also informing shared decisions to be part of the research. So we need to work much more on the primary caregivers or any trusted supporters to be part of the research, so that we include individuals who have neurodevelopmental disorders. And we need to also adapt it to the local context, and also we need to understand the cultural context of the cultural context of the country that we are doing the research, so that we have a good way of communication with these individuals. That's my thought.
Thank you, Rick. Ashok or Zsófia, would you like to add anything to those comments around further inclusion and communication adaptations for people with NDDs to participate? Ashok, I see you nodding.
Yeah. Thank you, Sharon, for that question. I did feel in fact, I must say, as part of this presentation and preparation for this presentation, I've been thinking, like I said, the engagement with research at least in our context here that I can comment on, they probably are not fully aware of what it actually means. They might understand, some of them might understand the word research, they might understand that so many processes happen as part of research, but they might actually not, I think when you say we have to communicate the idea of research, I think they need to really, there is a lot of effort that's needed from our side, which is why we decided to take help of the families to help us understand this, that how is that person who is actually filling up the form aware that, what is this broad research process? We would have written everything in the information sheet. It all starts becoming a very, it's like there's a laid out procedure, we seem to follow it, but the real idea of how they really understood that they're actually signing up for a research, what it actually means, I think there is a lot of thought needed there. And I won't say that I have a very clear answer right now about how to communicate this to them. There is also the worry that when families, when they come to a clinical setting and they think they're actually signing up a form, they're just wondering, if they're signing up for something that is in some way, can be in a context which can probably prove worrying or threatening for them in some way. And, and the fact of having just signed up, they may not fully understand, okay, this is the narrow boundary within which this consent is now applicable. They might kind of, even though, it's not possible for us to kind of, give an elaborate scenario to them about, don't worry about this, don't worry about that, none of this is going to happen. We don't really say these kind of things. That definitely brings the question of, if there is a research assistant standing there helping the families understand what it is, it would be really great. But funds might sometimes come in the way of that. But for them to understand that this is the narrow boundary around which they've actually signed up this form. And these are the processes that are going to happen. And every one step in that process, even though it's written in the subject information sheet, that every step in that process, they are free anytime to actually withdraw from that. I mean, I'm not very sure they really fully get the sense of what they're getting into when they say they're signing up for research. And I think a lot of communication around this is very necessary, without making it so elaborate or making it so complicated that they would just, we're actually scaring them away from participation in the research. So I think some creative ways to communicate the fact of participation in research, I think, is very crucial. That is something that's kind of hit home as part of this preparation for this presentation. And we sincerely hope families will get it from that.
Very important issue in defining that space that you spoke about, the context in which your research took place. That I, as a patient, I'm coming to a space as a patient. My main orientation is how I will get services. So if I get a form, I might think this is just another one of those patient-related forms. So how, in fact, to constellate our research so that we're very careful to think about the context within which the participant experiences him, her, or themselves in that space, and to build in ways to bring about an understanding that this new set of forms may not quite be about that context. And as you were speaking, I just had the thought about how one might have the core research team, but when one steps into those clinical spaces and uses staff to hand out forms, they become an extension of our research team, really. And how do we then reorientate them as well from their clinical role to this additional role? So I hear what you're saying, that there's very careful consideration needed of how we enter into clinical spaces for research, so that we offer clients some sort of protection from a misinterpretation of what they are signing up for. And I see you nodding about that. So thank you for that, Ashok. Zsófia, there's a question for you in the chat line. I have a question for Zsófia. Would you please share more information about your research on empowerment? For instance, who should be empowered? The research participants or the investigators? It is great to know that one has to be careful with the cultural background. However, I'm just wondering, do you find something that is in common with your study on empowerment? So the issue of the empowerment of research participants and then the empowerment of investigators. Would you like to respond to that question, Zsófia?
Absolutely. Thank you for the question, and thanks for bringing it to my attention, Sharon. So after the study that I talked about briefly in the presentation, my work that followed was taking place in Ethiopia and then in Argentina, respectively, in the form of 2 case studies. And so I'm now in the process of analyzing data from that comparative perspective, looking for similarities across really substantially different cultures and contexts. And so to give you one example as to what does seem to be common in this space, so I'm looking at caregivers specifically, how caregivers can be supported in raising their child with a neurodevelopmental condition, including autism. And so one similarity that I find very interesting, and one that I, to be honest, did not expect when I started this work, was about female caregivers, how many women in very different contexts become single mothers in the process. So the family very often breaks apart. And what I found in both of these contexts is that is the additional challenges that single mothers face when they raise a child who needs some additional support. And so those additional challenges would mean how to work and support the child in the same time, how to find and how to have the time and the resources to have access to services that might already exist, but that might require that time and like time investment to find them. And so this was something that I saw both in Ethiopia and in Argentina. And it's something that now I'm hoping to look at it more specifically. It was not something I I was not looking for gender differences or gender related issues specifically, but it was something that quite robustly came up. And in terms of how empowerment or service development would help here is by being aware of this process, or like single mothers, very often only single mothers being present in the life of this child, is supporting this mother not only through caregiver interventions, not only targeting in a niche area the mother to support the social and communication skills of the child, but a bit more holistically to also support and acknowledge that that mother might have problems having a job or going to that job, or might have to miss therapy sessions or service or an appointment with a service provider because she has to go and attend to her job as well. So I in my view, that is something that we can take on as professionals. And I also just wanted to react to the previous question on the consent forms in research. And so just adding on to what Ruth and Ashok said, I also think that a point I would personally really like to add to these consent forms is us researchers also consenting to and committing to then disseminating findings. And I think that relates back to how persons with disabilities, persons with neurodevelopmental conditions can benefit or can be an active part of research. I think very often we talk about how we can involve them. So there's this narrative of us and them in the research process. And I find, and in the whole PhD process, I find that it's kind of up to me to decide if I, in the end, go back to these countries, to these places and disseminate the findings, because there's no legal or ethical checks and balances that would make sure that I do go. So it depends on my supervisor, whether my supervisor pushes me so that I do that, or it depends on my ethical or even on my level of funding. So something I would add from our side, from the researcher side, is us committing as to what we give back to them, so to say.
I think I'm really excited about that question because I think in the presentations, the question to you, I'm excited about that, Zsófia, because I think in the presentations we've seen that in as much as we're conducting research with participants, we are also as researchers always on a learning curve. Becoming empowered to do more ethically informed research. And I think in Ruth's presentation, you spoke, Ruth, about the role of ethics committees. And you mentioned the issue of ethics committees maybe not having sufficiently empowered reviewers that are informed about the issues related to neurodevelopmental research, and that it would be good to be building that capacity on research ethics committees. But I'm also thinking of the role of ethics committees through that knowledge, empowering research teams when they review their research, where they may be new at that research, to be pointing out the gaps and the potential pitfalls that they need to be considering. So there seems to be a wide range of people who need capacity development and empowerment to ethically conduct research in this field. There is another question, a comment in the chat, and it's from Manjulika Vaz, who asks, could there be therapeutic misconceptions or fears of labeling and its consequential stigma? I take it that I'm not sure who that's directed to. It seems to be compatible with Ashok's presentation, but maybe Ruth and Zsófia also have some comments. So Ashok, do you have anything that you'd like to say in relation to your study? And then perhaps the other two presenters may add into that question. Thank you.
Sure. There's definitely, I agree that issue is there, which is where the issue of, the caregiver who is actually participating in the research, how much are they prepared to see the actual I mean, what when I say what they're signing up for, what can be the outcome of the activity that they are entering into, and how these questions about some challenges in the child might actually come up. And then there is this very not so well understood worry about what could actually happen, or probably very well reasoned worries as well about what could happen. And just I think these issues that have been just pointed out brings the issue of how much how well respondents are prepared, and they are and you brought up the issue of communication earlier, how much they understand, how much they actually have a discussion with any member of the team before they say, okay, now I understand where it is. I'm quite keen to find out, to participate in this study. So I think these issues of stigma and worries about what could it mean, and what would that further second step detailed assessment, what could it lead to, or what are they going to actually say about their child? I mean, this is a very, very key question around the kind of research we're talking about here. And especially if it is for identification of neurodevelopmental disorders, I'm sure these are very fundamental questions. And how much of communication and preparation of the carers to take the information that might result at the end of the study that happens, I think is extremely crucial. And yeah, I concur with the issue that's been raised there. Sure.
Yes, thank you, because one can only consider the anxiety parents might experience, and not realizing they have been screened, and then to be called as the question poses, there may be fears and anxieties around what this means for their child and for their family, which, as you then say, Ashok, could be addressed by, again, the information being presented in a way that is giving people free choice to participate around something that they then understand would be about bringing benefit to their child while addressing concerns of stigma. Thank you. Zsófia or Ruth, would you like to contribute to that discussion?
Thank you for the question. Yeah, what I feel and what I understand is that by promoting the inclusion of people who have neurodevelopmental disorders, we are also tackling the issue of stigma. Of course, it's the issue of stigma and discrimination is very much high. It's not just only for these individuals, but also for their families. So if we are promoting this research, we are also working on these issues. So I feel like that it's a form of tackling the issue of stigma and research, stigma and discrimination by involving them in research. So we are addressing the issue in that line. That's what I understand.
Thank you. I don't see any further comments in the chat, questions in the Q&A session. We still have some time, but unless there are further questions or points from the committee, we may consider drawing our session to an earlier close. I will just go back to the panel and ask, before we do that, if this discussion has raised additional things that you would like to share with us before we do close, unless there are more questions. Ashok?
Yeah, thanks, Sharon. I was actually wanting to know from Zsófia. I mean, when it comes, the first meeting that the family group had, trying to understand our research and thinking about defining their own roles and setting up a calendar for themselves. I mean, we clearly, we did not want to comment anything there, but we felt that, they are probably not feeling empowered enough. And it's a very, I mean, and since you talked about empowerment, I really want to know your view on this. Now, they spent an hour and a half, and that's 8 of, and as it happened, it was entirely pro bono. Now, do you think if we offer to pay them, it's actually going to create a conflict there? I'm really troubled by this, because I want them to meet periodically and kind of do the work that we're actually requesting of them to do. But the very nature of bringing a payment issue into it, I'm not sure, but working a lot for us actually. So I'm really curious, what do you think of this conflict that could arise?
Thank you so much for the question, Ashok. I think it's a genuinely tricky one. I will share what I personally think about it. I wouldn't suggest that. I think people may disagree with how I see it. And I do think it's a controversial issue. So I think, when I was in Ethiopia, I saw some NGOs or hospitals adopting a strategy in which they would pay the caregivers. And then I saw some others that did not. And the argument that I saw for making the payment was what you're saying, that they might not otherwise have the time, they might have a lot of different priorities. And then those who did not pay the caregivers, they said it was because of a lack of funds. And then they made the argument that caregivers should want to do it for the sake of having access to some sort of support, so that the initiative has to come from themselves. So this is what I saw in Ethiopia. And then when I was in Argentina, it was extremely different, because I actually went in with the assumption that what I saw in Ethiopia would also apply in Argentina. It was completely wrong. They said, well, we have never ever paid our research participants or participants coming to attend our interventions because we don't have the funds. And if we start paying the participants, then basically we would then raise the assumption that people take it as a payment opportunity. So these I wanted to highlight because I think on the one hand, this contextual element comes into play. Sometimes if an organization has access to very often international funds, international NGOs or international research institutes, then they will have the capacity to make it happen. Whereas in other contexts, like the research organizations I was in touch with in Argentina, they simply didn't. So they made different decisions. As to, I think in research specifically, if there is the assumption that in that country or in that context, this is something that everyone is doing, then I think it makes sense. Introducing the idea of paying a participant does have, I guess, ethical and moral consequences though. And I think when it comes to caregiver empowerment outside of the research context, in my view, it actually goes, the initiative does have to come from the caregiver. So therefore I personally wouldn't pay for participants to come, but I would make the intervention or the program as such that it covers skills over and beyond helping that one particular child with neurodevelopmental conditions, so that it becomes a program that helps them access opportunities beyond that, that would help the well-being, including the financial well-being of the family. This is my view. I know it's a very controversial question.
Zsófia, your sound wasn't too great for the last couple of minutes, but I did understand quite a lot of what you said, but the sum total was that you had concerns about paying participants from your experience in all three countries, even though you found that the context of payment was different in those different settings. And I think that is an important issue. I'm just thinking of some research I'm busy with at the moment where, our national research ethics framework insists that we pay participants, particularly as many of participants in our studies are poor people who we are then putting a burden on in terms of travel for the research, their time being considered less valuable than other people's time. I've got a research advisory committee where I have typically developed and people with intellectual disability on the advisory committee. Do I pay the professionals and not the people with intellectual disability or the same role? So I think these are things that we really have to carefully think about. What is the burden of care on the participants? Do we tell people up front that we will or won't pay them? Do we recruit them and then say thank you for agreeing to participate, and as a token of our appreciation, we will, now that you've been included, be giving you some token of monetary or a food voucher or whatever is contextually appropriate. Such important things to be thinking through. Ruth, I didn't give you a chance to add your comments from your experience around payment.
Okay, thank you. Yes, we usually pay participants for their time and also for the travel. So it's not too much that is like a bribe, but we need to also appreciate their time, and also that we have to pay for their travel. Otherwise, it won't be balanced, and we are not showing also respect. So we pay them. We pay the participants.
Yeah. Right. One last comment a new comment in the chat. Thanks for the excellent presentations. It's really important to raise awareness so that there is societal acceptance and inclusiveness of disability. And I think, thank you for that comment. I think that the issues that have been raised here, there's a myriad of issues that impact on how people get included in research, and then how research can inform their inclusivity, as Ruth was demonstrating in her presentation. Any further comments from the panel? No. So I must thank the panel, Zsófia, Szlamka, for your presentation on empowerment, Ruth, Tsigebrhan, for your presentation on the need to be more inclusive of people with neurodevelopmental disorders, their families and supporters in the conduct of research, as well as the translation of the findings of research into service delivery that can improve their lives. And then to Ashok for sharing with us some of the dilemmas of designing research to make sure that participants are well informed, and that where there is research conducted on clinical work, that the careful boundaries between that be well thought through ahead of time, so that the research can have an uptake for participants in terms of improving clinical care to them. I see there's some comments in the chats thanking the presenters for the presentations. I'd like to add my thanks to them as well, and also to those who attended and for your questions. Thank you for coming to join us and participating in this discussion. I'm going to call a close to the meeting. And just to remind everyone on the call that there is one more seminar in the series, which will take place on the 23rd of November, and which will focus on the ethics of mental health research involving adolescents. And I invite you to go and check the GFBR website for more details and to register for that webinar. Thank you so much, everybody, and enjoy the rest of your day. And good luck with all your research on neurodevelopmental disorders. Thank you.